So the issue is the regulatory agencies have done nothing. They have unfortunately turned a blind eye to this. The FDA, the EPA, and the CDC, great organizations, wonderful people working there, but they just haven't done anything. The CDC has not updated their guidance since 2008 on cleaning of mattresses. And the 2008 guidance didn't really change anything from the 2003. CDC could say, effective immediately, clean these beds to a high level every single time. But they call it a non-critical surface. They say it's non-critical because it doesn't touch non-intact skin. Last time I checked, every single patient has non-intact skin. They've got an IV in, they've got a dermatitis, they've got a pressure ulcer, they just got an operation on their hip. That's non-intact skin. And yet we lay the patient on there as if they're being laid on in a perfectly clean space. And they're not. We know they've put it in the non-critical category, which means you can use low-level disinfection, you don't have to use high-level disinfection, you don't have to remove C. diff. And this is just crazy. There's now a big outbreak of a new Candida species, auris, that's occurring over in Europe, and it's coming to the US. It's already hit here. And again, you don't know which beds have it. Well, if you don't know which beds have it, you need to clean every single bed the same way every time, high-level disinfection. But the CDC says, nope, non-critical. The EPA says, oh, use the chemicals we got. Oh, by the way, you can't. Every chemical that's in the hospital today says on the side label, for non-porous hard surfaces. How can you clean the mattress with a chemical that says don't do that? And that's what's done every day. Even bleach, even the bleach manufacturers, which I love bleach. Bleach is fantastic, okay? It kills some of the meanest, nastiest bugs on this planet, okay? And we need bleach. Please, we need to keep using bleach. Problem is, it says right on the side of the bottle, for non-porous hard surfaces. And then Clorox just came out with a notice saying, oh, by the way, our bleach product's really not compatible with polyurethane mattresses. Oops, that's what they're all made of now. We need to use it, but it's not compatible, so it really has to be rinsed. So this is that multi-step process. So the recommendation is becoming, I need to clean. I've got to remove all the poop off first. Then I need to remove all the microbiome off next. Then I need to rinse, because if I use a disinfectant, it's not compatible with the bleach. They work against each other. So I need to rinse it. I can tell you right now, there's not a hospital on the planet rinsing after they clean, then disinfecting, and then rinsing again to remove it off of the thing. And it just doesn't work. And so nobody's doing that. That would take them an hour just to clean the bed. They'd be tied up for an hour. And that hospital has got patients coming out of the operating room, patients down in the emergency room. I had 50 patients, inpatients, being held in my emergency room last week. 50. So the pressure on the EVS people is get that bed turned right now. The EVS people are wonderful. And I get so angry when I hear them blamed because, they didn't clean well enough. They've been given an impossible task. You can't ask somebody to clean a room in 20 minutes. It needs to be an hour, hour and a half at least, okay? You want to clean every crevice. I personally, as a patient or as a doctor, want to see a really clean room every time. And we have just kind of turned a blind eye to this. The hospitals, they're under extreme financial pressure. Margins are so close. And now I'm asking them to triple their EVS staff.